Hey there, welcome back to Health Made Simple, where we untangle the messy world of chronic illness and caregiving, one video at a time. In our last video, I mentioned my dad's increasing confusion, his uncontrolled diabetes, how it led us down the path of vascular dementia. Today's video, this is the deep dive I promised. We're going to break it down simply because let's face it, no one gives caregivers a manual for this stuff. What is vascular dementia? What causes it? Can it be diagnosed for sure? How is it different from Alzheimer's? And are there treatments? And most importantly, where can you, the caregiver, find help without losing your sanity or your savings? So grab your coffee and let's get into it. First, let's answer the big question. What even is vascular dementia? It's not just getting old or being, forgetful. Vascular dementia is the second most common cause of dementia, right after Alzheimer's. But unlike Alzheimer's, which is caused by those famous brain plaques and tangles, vascular dementia is all about blood flow or lack of it. When blood flow is blocked because of a stroke, a series of mini strokes, or just years of high blood pressure or diabetes, parts of the brain don't get the oxygen they need. Brain cells die then. So thinking, memory, and behavior, it starts to change. Most people with vascular dementia have multiple risk factors. That includes like high blood pressure, high cholesterol, diabetes, hi dad, smoking, and heart disease, as well as history of strokes or TIAs, transient ischemic attacks, also known as mini strokes. These mini strokes isn't no big deal. It's your body telling you, fix this now before it gets worse. And 1 in 3 people will have a major stroke after a TIA. But there's some good news. With treatment, that risk drops fast. It's not just fate, it's really science, and it's fixable. Here's what the data show. High blood pressure is the biggest modifiable risk. With a 20 millimeters of mercury, a unit of pressure increases vascular dementia risk by 26 to 62%, even before any strokes happen. This number 20 increases is the number of increase on the top of your blood pressure reading. For example, if your blood pressure is, let's say, 150 over 90, you're in the category of stage 2 hypertension. Usually means you're taking probably at least 1 to 2 medications. Now look at that top number, the 150. If it's above 20, then you're normal. It's going to increase your risk for stroke or those mini strokes, and that is a high level increase of you developing vascular dementia. So really check your blood pressure, take your medication, and keep those numbers down. So a prior stroke or a TIA adds another 70 to 120% risk for dementia. Diabetes doubles it or triples the risk. We're not just speculating, guys. This is research that shows diabetes nearly doubles vascular dementia risk. A huge Dana study found a 98% increase, and a big meta-analysis, 127% higher risk. Those are high numbers. And so it tells us that diabetes, again, like high blood pressure, if you have those, you're likely going to develop vascular dementia if it's not controlled. So better diabetes control isn't just about sugar levels, it's directly tied to your brain health. I wish that I had this information earlier, and perhaps I could have helped my dad to control his diabetes better, because he's sitting now with a diagnosis of vascular dementia. And this is why I do these types of videos. It might be too late for my dad, but if you or your parents have diabetes, check your A1C level. Now, going back to the other risk factors for vascular dementia, there's also heart disease, smoking, and cholesterol. All this matters, right? But just less so. Vascular dementia, what does it look like over time? Well, confusion creeps in, personality changes, memory falters, and problem solving slows. It's not sudden, it's gradual. So most may not even notice it. Now I want us to share a story with you that happened recently. I stayed with my parents for 3 weeks to help my mom with a recent spine fracture. I'll put a link about that spine fracture at the end of this video. So my dad, who's watching TV most days, and pretty much all day. And one of those days he was he was agitated because the TV wouldn't power on. And he was blaming my mom for it. And that's typical of my dad. So him blaming my mom is not unusual. What was unusual is that he wasn't able to troubleshoot it. Now we're talking about a very astute and a rational man here. He was an engineer for a large technical firm for a number of years. The problem was that the battery was out. It was incredible, a bit disturbing, and overall sad to witness my dad not being able to figure this out. I'm sure there are a lot of caregivers out there listening to this that may have witnessed the same possibility with their parents. If so, would you like to share your story in the comment section down below? I think it's comforting to read other people's similar situation. Kind of gives an indirect support. How do we diagnose this vascular dementia? Here's the frustrating truth though. There's no single test. There's no blood work to confirm vascular dementia. Diagnosis is a combination of these things that you have to test for. One being a neurologist exam, a detailed history, medical history, whether they have had stroke, they have diabetes, high blood pressure, and also cognitive testing. Those are testing for memory, math, problem-solving puzzles. And also brain imaging. That can tell you whether the patient had a stroke. My dad had all those 4 done in order to conclude a diagnosis of vascular dementia. And luckily, at least the brain imaging, the CT scan did not show that he had a mini stroke. So that was one good news, but definitely his high blood pressure and diabetes being uncontrolled was probably the biggest factor in his diagnosis of vascular dementia. So for diagnosing vascular dementia, there is no easy blood test, no quick answer, really a collection of patterns, brain damage, medical history, and noticeable cognitive decline. As such with my dad's case. Vascular dementia is not curable. I wish I had better news, but here's what you should know. It is progressive. It often progresses in steps, stable for a while, then a sudden drop after another stroke or health scare. In our case, diabetes. Over time, it can lead to severe disability, loss of independence. We can see that now, loss of recognition, something that really I'm dreading, but I know it's inevitable, at least for my dad. Some people live 5 to 10 years after diagnosis. Some people decline more quickly. It depends on overall health, stroke risk, and how well we control those chronic conditions moving forward. For my dad, the disadvantage is that he recently, a year ago, had 4 stents placed and he had his aortic valve replaced. He has the heart disease as a component as well. So his prognosis of 5 to 10 years, I don't know if that's really true in his case. It might be shorter because he does have other chronic issues related to cardiovascular health. Let's take a moment to clear up one of the biggest sources of confusion out there. What's the difference between Alzheimer's disease and vascular dementia? They're both forms of dementia, we know that, but how they show up and how they progress looks pretty different. First off, Alzheimer's usually starts slow and stays steady, like a slow fade. Memory tends to go first. You might notice your loved one asking the same questions over and over, forgetting dates or getting lost in familiar places. It's caused by those classic brain plaques and tangles. And it tends to hit more aging women than men. In the case of vascular dementia, well, it's often more of a step-like decline. Things seem okay for a while, then suddenly there is a drop that's usually tied to a stroke or a silent stroke or worsening of blood vessel damage like hypertension. It's not memory first, it's usually judgment, decision-making, and problem-solving that goes first. And that's the case of my dad. So while Alzheimer's is about what's happening inside the brain cells, vascular dementia is about what's happening to the blood flow getting to the brain. Blocked vessels damage arteries. Think strokes, diabetes, and high blood pressure when it comes to vascular health. So if Alzheimer's is the slow fade, vascular dementia is more like a staircase. Step down, hold steady, step down again. Different causes, different symptoms, but in the end, both require us as caregivers to step up with patience, compassion, and as much help as we can do or find. Well, another thing is that someone can actually have both Alzheimer's and vascular dementia. That's called mixed dementia. Because why make this easy, right? Now, treatment isn't exactly the same for Alzheimer's and vascular dementia. There's no magic pill for vascular dementia. But then what does help? Well, controlling the risk factors like blood pressure, diabetes, cholesterol level, stop smoking, and preventing more strokes. Doctors might also try the Alzheimer's medication like Aricept off-label, but it's a hit or miss. There's no cure, no reversal, just slowing down the decline. All right, let's talk about something that doesn't get enough airtime, Caregiver Resources. I know there's a lot of you out there. Because dementia doesn't just affect the patient, it affects the entire family. Well, emotionally, financially, physically, and my gosh, mentally. So here's some of the resources. One is the State Health Insurance Assisted Program, SHIP. That's the State Health Insurance Assisted Program. Free, unbiased help for families navigating Medicare. They'll walk you through what's covered for dementia care, home health, hospice, and whether your parents qualify for savings programs. And they won't try to sell you anything. They exist to make Medicare less confusing. That's a good thing. Next resource, this is for all the veterans out there. There is VA caregiver support. If your parent is a veteran, check out the VA caregiver support programs. Benefits might include, well, extra financial aid. And who couldn't use extra financial aid, right? Through their directed veteran-directed care. And even stipends for family caregivers. They also offer training, respite care, and support groups. Lastly, Alzheimer's Association. Whether it's vascular dementia, Alzheimer's, or mixed, the Alzheimer's Association is your go-to for support groups, care consultations, and respite care grants. They even offer 24/7 helpline support. Now, these support programs that I mentioned in this video, I will have links to it and information in the description part of this video. And let's do a quick reality check on finances. Medicare covers medical needs. It doesn't cover custodial care, help with bathing, dressing, or living assistance long term. Medicaid might help if your family's finances qualify. Some states offer even Medicaid waivers for in-home caregiving. Also, SHIP counselors can help you figure this all out. Something to note, though, is that with the atmosphere, the political atmosphere that the U.S. is going through right now, there may be some changes to Medicare or Medicaid. So before doing anything, you might want to check their website, especially visit the links in the description part of this video. And look, if you're watching this, you're probably, well, tired, overwhelmed, maybe even a little bit angry. That's all normal. This isn't just a diagnosis, it's really a marathon. Support groups, respite care, asking for help, it all matters. And burnout is real. As for my mom, she's tired too, but she's still cooking my dad's meals, still reminding him of his appointments and driving him to his appointments, and still holding it together. Well, most days. But I'd say that's enough. So if this video helped you, please like, subscribe, and share this video with another caregiver who needs to hear this today. Also, drop a comment if you want me to cover caregiver burnout, Medicare, or even long-term care planning next, or anything that you have in mind about keeping health simple. So see you next time where we keep health, well, simple, even when life isn't. And those of you who've already subscribed, thank you. Your subscription really helps in the long term for me to put out these kinds of videos to help someone from the lessons we learned to maybe keeping their health a little bit longer. Bye-bye.